Hi, I'm Dr. Rajani. I'm super excited today to tell you about an eye drop, a simple once a day drop you can put in your eye that might just change your life because it's changed the lives of many. You notice over time, the eye gets a little droopy, there's a little excess skin, it's a little dull. It's not as white as it used to be. Maybe the lids are a little lowered. That happens normally over time as we lose collagen and elastin and the muscles just don't function like they do or they have in the past. There's a drop that can change all of this, and that's what I'm talking about today. I'm actually going to put one drop in one of my eyes, and as the video goes on, you can follow it and let's see what happens. We have to keep in mind that we're judged by how we look, particularly our eyes. First thing you do when you meet someone, you look them in the eye, and then typically the gaze goes down to the mouth area. In the eye, we're picking out, are they tired? Are they awake? Are they rested? Can they get the job done if you're in an interview? If you might be going out at night after a long, hard day of work, or if that's part of your work, going out like mine, you might not feel like going out. You feel tired, you feel like you don't look refreshed, you put a drop in and boom. I'm going to tell you about this drop, what it does, how it works, how you get it, and some of the side effects. Below the video where it says more info, I'll put a link to exactly how you get the product and current pricing. Let's put an eye drop in one of my eyes and get on with this video. Of course, caffeine, get your Rajani mug if you haven't, but caffeine also helps open the eye. Okay, so the product is called Upneeq. It comes in a box like this, and there's individual packaged product in here. Okay, so you get individual vials, and when you take it out, it looks like this. And where it says show more or more info below this video, I'll put the links as to the cost and to how you get it because it is evolving. I can keep that link updated. But when you take the single package out, it looks like this. And I'll put one in, we'll do my right eye, I suppose. Single package because there's no preservatives in this. And when we talk about different eye drops, preservatives are important. Each one of these will do both eyes. So I just kind of give it a little flick and the dropper comes to the bottom, and you can put your drop in like that. That's a single drop. I haven't tested it, but this does both eyes. There's probably about 4 drops in here. So some people would do a little more volume in each eye. I just put a little tiny drop in. Let's see what it does over the course of the video. There's a little water here. So I like the fact that there's no preservatives in it. Now, what are you looking for? I'll tell you how it works in a moment, but you see what I see with it and why I love it is it whitens the eye, and I'll tell you the mechanism. For me, I find that the eye's a little too open for the first maybe hour or two. It's subtle, but this is personal preference. Everyone's eyes built a little different. Keep in mind, females have wider open eyes, less frontal bossing of this bone, whereas males have more bone here at the orbital rim and have narrower eyes. A lot of females are tilted up like this and men are more flat to down. So there's all kinds of differences, and the anatomy of the eye and the tear trough can play a role. But in general, it's very unique in that it makes people just look rested. So keep that in mind. And it does last the whole day. In terms of comfort, I feel like my eye feels more soothing during the day. It feels more not only rested because it's a little open, but less dry, more comfortable, I'd say. Because some drops you might notice you put in your eyes and it makes them feel a little burny, a little dry. This is actually pretty soothing. I do put it in the morning. I find that by the evening time, I don't need to add any more. It really does last 12 to 16 hours. Sometimes I wake up the next day, I wonder if it's still working because it does look like my eyes whiter, brighter, and even more open that far down the line. I'll tell you in future videos why I think that's happening. But let's go through what it's supposed to do. So I don't know what you're seeing now, but you should see over time the eye open a little bit and get more white than this eye. Now, maybe it's very dramatic. I don't know. Maybe you're all laughing at this point. We'll see. But I usually look at my eye about an hour after I put the drop in. It works sometimes in the studies up to 5 minutes, as quick as 5 minutes, and sometimes it takes up to 2 hours to fully work. So you see it is a long-term type of medication. Now how does it work? Well, if you remember Afrin or use Afrin for other purposes, Afrin is what this is, and it'll tell you right on the box it's oxymetazoline 0.1%. Afrin's usually used in the nose to open it up. So this is very unique, but what it does is the fight or flight system that we have in our body, the sympathetic tone, it increases it. And there's two muscles that are important in lifting the eye. One is the molar muscle, and the other is levator palpebrae superioris. Both kind of mouthfuls. But one, the levator muscle, the latter one, is like skeletal muscle. You lift your eye on purpose. So it's a striated muscle. The molar muscle, however, is a smooth muscle. And because of that, it's involuntary. So this is acting there. So unbeknownst to you, that muscle is getting hit by this sympathetic tone, fight or flight. Fight or flight says, hey, open the eye. That's when you get scared or startled. You open the eye more. Your heart rate goes up. That's opening the eye. So you can't control that muscle, suffice it to say. There's 3 types of muscle in the body, the third being cardiac. So that's how it works. And that's why, as an alpha agonist, you're getting the whiteness of the eye. And again, I don't see rebound with this, which is pretty amazing. I'm not exactly certain why, but my patients don't either. Rebound is when you get more redness after a few days of using something because it stopped the oxygen supply to the eye, and the eye says, we need more blood, and you get spasm and the arteries open up more after a few days, and then people start using the drop on and on and on because the eye's redder and redder, and you become dependent on the drop. This does not seem to occur with this. Let's talk about some of the potential side effects. Now, as the eye is open more, you could get dry eye, of course, because there's more air, more pollutants, more smoke possibly getting in towards the eye as it is more open, or the product itself. Some people will say they get dry eye. Keep in mind, we're talking about acquired drooping of the eye. So normally it was a little more open for the person anyway, because after the age of 50, about 10% of people have lowering of the lids. We call that acquired, and that's just over time, as I spoke about. So dry eye is one of them. Red and irritated eyes is possible, but because it is in a single-use packet, there's no preservatives. A lot of times it's preservatives that cause people to have irritation to it. People with high blood pressure shouldn't use it because I talked about that sympathetic system. It clamps down on the vessels, so it's in there as something to be considered. As well, you can also have more field of vision. Now that's interesting. It's not a real side effect, but people do notice that they get more light, that they see better because the eye is open more. And it's interesting, in the studies, it opens the eye about 1 millimeter to some people up to 3. So people would say 1 to 2 millimeters of eye opening. And that's enough to change the vision. So keep in mind, you are going to potentially see better. People with excessive skin above the lid, a lot of skin where it's resting on the lash, those people are still going to probably want a blepharoplasty and get surgery. But for a lot of people that just have a little bit of loose skin above the eye, it's not resting on the lash, when the eye opens up, they feel like they can delay surgery, or they feel like they're much happier with the way their eye looks. It's really hard to put your finger on exactly what they're seeing. It's just a brighter, more youthful, better looking eye. It's a very unique product in that way. Okay, I just went to look at my eye so I know what you guys are seeing. I can see this one's open and brighter. I can't go around like that today, so I'm going to treat the other one. I always treat both normally, of course. So I've never seen it with one eye before. So while maybe you're going to watch this one now open up a little bit and get brighter, I want to show, let's look at a couple pictures. If you look at this picture here, are your eyes looking a little tired? Have a little look. This is what we're talking about, the congenital slight drooping of the eyes. And I want you to see a couple things. One is the eyes are just a little lower. That happens. There's not a lot of loose skin for this person, but also look at asymmetry. I know everyone's focused on symmetry when we talk about nasolabial folds, brow height, everything else. And a lot of people don't know they have it until, say, I treat them or I do neurotoxin on them. But look at this picture. That person's going to notice that their eyes are asymmetric. One's different than the other. Even the angle of the eye is different, and the skin above the eye. The bones on our face are different on either side. The skin is different. This is normal. The asymmetries in the face, in many studies, show that we're more trustworthy with some asymmetry versus perfect symmetry. Gross asymmetries are a different story in the aesthetic studies, but keep in mind and don't perseverate. Each eye is going to look a little different. When most of your friends have never ever noticed your asymmetries, you do. So keep that in mind. It's a natural part of how we look, and embrace it. With this drug, of course, some people are going to treat one eye and not the other because they might have a congenital reason, or they've always had a bit of a droopy eye. But then you probably need a whitener in the eye that you didn't treat, because one eye will be whiter and brighter. I really like the way my eyes feel with this product in it. So now let's go to a couple of before and afters. Actually, first I want to show you different levels so you can judge. This is acquired ptosis, and let's look to see the certain levels, because this is what your practitioner before you get it will assess. A normal eye, A, B, mild ptosis, C, moderate, D, severe. And severe, it's going right through the middle of the iris, the colored part of the eye. That's quite a lowering. Of course, everyone will respond differently because this is a drug and the body responds different to different drugs, of course. Now let's look at some examples of the before and after. This isn't if you're not seeing it in me, we can see it on these pictures here. You're watching live, and now let's look at some examples. So if we look at the first one in the top, mild ptosis, we see a nice increase in the lid. The upper lid is just elevated. Again, the person isn't knowing that the eye is lifted. I'm not aware right now that my eye, when the eyes are more open. I can see better. I totally can tell that I see better. I see more. I like it. Maybe some people don't, but I like it. If you look at the next one down, you see just kind of what we might say a sleepy eye. And that's a good look sometimes. Nothing wrong with that. But there are going to be times when that person wants to open the eye, and now they have a choice. And that eye on the right just looks rested. If you're going for a job interview, if you're going to meet someone for the first time, you might want the eyes on the right that are a little more open. I really like the whiteness effect of this. I have something called surfer's eye, which is when you have a lot of UV exposure with salt water, how I grew up. So we didn't use sun protections in the water a lot. I'm on the water with water sports. So I love the fact that your eye's brighter for the whole day. And then if you look in the bottom, the severe ptosis, that person is quite a dramatic lift there. Now maybe you're using other drops as well, and you're saying, well, what if I use other drops? This drop should be put in and then you wait 15 minutes, or vice versa. 15 minutes between the different drops you might be using. For contact lens wearers, they can use this drop. You just want to put the drop in, wait 15 minutes, then put the contact lens in. It's just one of these unique products that has so many benefits to it, and some of them you can't put your finger on or know exactly. People look better, they look rested, they look more awake. Are you using it? Please comment below. Love to hear your comments. Any more information you need. Again, if you want to know how to get it, this is evolving. How people are getting it was initially through one pharmacy only. Now there's newer ways to obtain it. I will keep the link below that you can click, updated for pricing and for availability and how you're best able to get it. Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.